Welcome to NP 702 Primary Care 1, which is the first of the 3 primary care courses in the series that you will be taking. I'm Dr. Vicki Stone-Gale, and I'm a family nurse practitioner and the course coordinator for Primary Care 1. And joining me this semester will be Dr. Delana Gardner, who is going to be the course faculty. So both of us will be in the course throughout the semester, monitoring the chat boxes, the discussion boards, monitoring any of the activity that's going on in the course, running the BBBs as well as exam reviews, and any of the other content that's involved with the course on a daily basis. I am a family nurse practitioner, and I have been practicing in the Fort Lauderdale area for about 27 years now in family practice. I did do a little bit in urology and a little bit in cardiology, but my main focus really has been in family practice for the entire amount of my career. I received my undergrad degree. I'm a diploma nurse, so I received my diploma from a nursing school in Ohio called Massillon Community Hospital School of Nursing. And then I went on to get my bachelor's and my master's degree as a nurse practitioner at Barry University in Miami, Florida, and then did my doctor of nursing practice at University of Alabama at Birmingham and completed that in 2011. I have been teaching for approximately 7 years, and I've been teaching this primary care course for almost 2 years now. So we're really excited to have you in the course this semester, and Dr. Gardner will also put a little blurb about herself in the people section of the course so you can read about her and what she has been doing. She is a Frontier Nursing graduate with her DNP, so that should make you a little more comfortable. She knows what you've all been going through. We will have a BBB orientation and question and answer session on Monday, October 2nd at 2:30 p.m., and that will be in the BBB, and I will be sending out an invitation in the morning for that. If you cannot attend, it will be recorded for you as well as all the other sessions. The orientation will cover the syllabus, we'll go over the course schedule and the general course instructions, as well as the modules, the exams and the assignments, the grading policies, communication, honor code, social media policies, and proctorio. As far as course content goes, there is a lot of content in Primary Care 1. There is a family health model because we do feel that it's really important that families are included in the care of the patient. We're going to be really getting you acclimated to breaking bad news to patients, and we'll be doing a simulation activity in regards to that. Eyes, ears, nose, sinus, pharynx, mouth, neck disorders will be all covered in Module 1. So as you can see, it's a pretty heavy module, and really all 5 of the modules are pretty heavy, but we've broken them down into 2-week sections, which gives you time to really focus on the content that's in those modules. Module 2 is going to be on male GU as well as renal and bladder disorders of male and female. Module 3 will cover all of dermatology, so you'll have dermatology for 2 solid weeks. And then we'll move into chronic and arthritic musculoskeletal disorders, which would be fibromyalgia, gout, osteoarthritis, rheumatoid arthritis, lupus, and then go into the anemias. And we do a little brief discussion on blood disorders with acute lymphocytic and chronic lymphocytic leukemia, as well as HIV, and just really touch on how you're supposed to recognize those problems, not manage those problems. But you will be managing anemia. And then Module 5 is upper and lower body musculoskeletal disorders, and that will be covered over a 2-week span also. So you can see that there's a lot of content in this course that you're going to have to be responsible for. So how do we want you to get started? Well, one of the things is to attend the BBB or listen to the BBB for the orientation. And then in week 1, start really thoroughly looking at the syllabus, reading all the information in the course, starting in the modules and go all the way down through all of the modules. Make sure that you read everything in the course before you start because there's a lot of information. Listen to the communication, policy, honor code, social media, and put your name. There's a place in the module section which is in the first bracket section where you can place your name in the student demographic section. And this is really nice if you've joined a study group or if we want to try to reach you and we don't know what your work hours are, if you put your work hours in there, that's a great tool for us to contact you during those hours. And it's also great for your colleagues and your classmates to contact you if they want to form a study group. You do not have to put your phone numbers in there. You can just put your FNU email in there, and that would be fine. And then you're going to go ahead and just start head on into Module 1. So how are you going to prepare for the modules? Well, every 2 weeks you will start a new module. And the best way, really, for you to do this is to be very systematic. Look at the objectives, read the objectives, understand what content is going to be in the module. All the topics are going to be listed for you. Go through the module readings and make sure you're doing those readings. Only read the content that's listed in the module because you don't need to read anything in addition. If it's not on the list of topics, you don't need to read it. If you choose to read it for your own benefit, that's fine. But look at the syllabus for the specific topics and look at the modules and follow that for that. There's going to be PowerPoint Camtasias in there, which will be lecturing to you. And we find some awesome YouTube videos usually that are just great that we incorporate into the modules. And there's a lot of things that you can pick up from those videos. And then the quiz information is in every single module. So make sure you go from top to bottom with the modules and you learn what's in those. As we look at the graded content for the course, there will be some different quizzes and assignments due. There will be a open book quiz in week 3, and that open book quiz is the only quiz that will be open book in the course. And the reason for that is because we wanted you to at least get a feel for what the quizzes are going to be like, what the questions might be like, and it'll just give you a good idea on what to expect for your further quizzes and exams. There's also 3 closed book quizzes. One is in week 5, one is in week 9, and then one in week 10. And all of the quizzes are remotely proctored, as well as the midterm exam, which will be due in week 6. And that usually is consisting of maybe about 40 to 50 questions, depending. And you must achieve an 80% average on all your exams to pass the course. Now, that doesn't mean you have to get an 80% on every single exam. You could get a lower score on one exam or a higher score on another exam or quiz and still pass the course. But overall, for all of the quizzes in the midterm, you need to have an 80% average on all exams to pass the course. And that is before we even look at the grades for all of your written content. There's also 2 assignments. One is a SOAP Note challenge assignment with written prescriptions, and with that, you are going to be challenged to try to figure out what the diagnosis is. You will be with the faculty on the big blue button, and we will be listening to you after we have given you a chief complaint. You'll work through the whole process of a SOAP Note to come up with the final diagnosis and the treatment plan, and then we'll write 2 prescriptions for whatever diagnosis or treatment you're going to have to make a decision on. There's also a Breaking Bad News simulation activity, and this is something that we did fresh and new last semester, and it was wonderfully received by the students. And this is using standardized patients from Wright State University, and we will be pairing you with a standardized patient, and you will be breaking bad news to the patient on the big blue button as we go through the sessions. There's a lot to discuss about that, much more to follow, but that'll give you just a little bit of an overview on what kind of grading you can expect. For the grade breakdown in the course, you're going to have 5 exams worth 16 points, and that will be 80 points total for 80% of your grade. The SOAP Note challenge assignment with a written prescription will be 15 points or 15% of your grade, and the Breaking Bad News simulation is 5 points or 5% of your grade. And that is not what you do exactly in the session, but following the rubric in regards to, are you on time, are you professional, do you participate in the debriefing and that type of thing. So you will have a total of 100 points in this course, or for 100%. When we talk about exams, there's no paper or pencil, no phones, no food, no one in the room with you, including pets. You can't have your cat crawling across the screen. You can't have your cat on the desk. You can't have your dogs barking. You can't have your kids in the room. You can't have your husband coming in the room. And you cannot be talking to yourself when you're doing the exam. There are no makeup quizzes or exams. I cannot stress this enough to you. I have had up to 5 students a semester fail my course because they forgot to take the quiz on the date it was due, or they forgot to take the exam by the date it was due. And this is such a disappointment when you get to week 7 or 8 of the course and you are supposed to take a quiz and the deadline is Sunday night and you realize on Monday that the quiz closed yesterday. So you will fail the course because you can't pass when you're missing that amount of points. So I can't stress to you enough the importance of making sure that you are actually taking these quizzes and exams on time. They're open for 1 full week. So you have, usually 1 full week to take them. There's no extensions on exams or quizzes unless it's a medical emergency that can be documented by a doctor's note, or it's a family emergency that can be documented by a doctor's note. And there are no exceptions to this, because if I do it for one, I have to do it for everyone, and we can't do that. There's also a 5-minute review at the end of the quizzes and the exam. And then you can make an appointment with the faculty for up to 3 days after the exam to be able to discuss the content. We can't go over specific questions for you. We can't discuss the questions, but we can talk to you about the content. Faculty do make an analysis of the exam. We do a quiz analysis and exam analysis after the exam closes. So we may end up giving a point back or something, or a half a point. We never know if there's a problem where too many people have missed it, or the question is not a good question or something. But we try to not to do that, and we try to look at them and make sure all the questions are set beforehand. Um, but we really, after 3 days after the exam, we don't want you asking for a review. And the reason for that is we've moved on to the next content and we need to just let that exam go. So we won't be doing any exam reviews after that. So you may not know how to take a test, and I can't tell you how to take an exam. I can't tell you how to study. Only you know the best way for you to study. But I highly recommend you go to this website and you take the questionnaire for the VARC, because the VARC really gives you a good idea on what your learning style is. And I took this and I was amazed. It was right on the head. And everybody I know that has taken this questionnaire, it ends up being very specific to them. So I would like you to go onto this website and go ahead and do that. So, what are some of the do's and don'ts for the course? Well, my recommendation for you is to plan to have your assignments done 1 week ahead of time. If you populate that 1 week ahead on your calendar from the due date, then this gives you a time to make changes, make any corrections, to add anything, delete anything, revise anything that you want to do. Um, you do need to notify the faculty within 48 hours in advance if you need to extend an exam or an assignment because of a medical emergency. That it's going to be, depending on a case by case basis, it may or may not be approved. And it really is going to depend on the circumstances. But you need to notify us 48 hours in advance if there is a medical reason that you are not able to complete your assignment or take your exam. I do recommend that you find a study partner or a group to get into, because this really has helped the students many times. And if you go into the first little bracket of the course under modules, you'll see that there's like a section there where the students have given you tips on how to be successful in the course. And I think it would be a good idea for you to maybe read those. Let faculty know if you're having difficulty. This is the problem that we seem to have sometimes with students, is that they don't tell us. We do not have the ability to know if your husband has left you, if your wife has left you, if your mom or dad are in hospice, if your son or daughter is critically ill, if your mother or father have passed. We just don't know those things. So it's really important that you reach out to me or Dr. Gardner if you feel that you are struggling because of a family issue. One of the things that I love about Frontier Nursing University is that your family comes first. And I want everybody to understand that your family comes first. So if you've got those issues going on, please reach out to us and let us know what is going on. We are here to help you, but we can't help you if we don't know. Some of the don'ts: don't try to memorize this information. You need to understand the information. You are really going to struggle if you don't understand it, because you cannot go out there and take care of your patients safely if you do not understand the information. Don't wait to begin a module or study for a test. I think it's important that you try to study at least 10 to 12 days ahead of time. We do try to do the BBBs about 10 days ahead of time, but you are responsible to start studying even before we have the BBBs. Do not start an assignment on a Friday if it's due on Monday, because the faculty are off on the weekends, so we will not be answering emails or phone calls on those days. So what you need to do is think about having that assignment started ahead, as I said, and don't anticipate that we will be there on the weekend to help guide you, because if your assignment's due Sunday night, you're going to be out of luck. So make sure you have any questions to us before Friday at the close of business at 5 o'clock. And try not to take your test when IT is closed, because that can be a problem. Okay. If you don't understand a concept, then you need to search for other resources to help you understand that concept. The quiz and the exam reviews are helpful, but they're not inclusive. So let them steer your studying habits, but don't rely on them for everything. Your success in this class depends on being able to use your resources successfully, and to critically think, and to incorporate the 3 Ps that you just came out of. So you are going to be bringing your physical assessment skills, your pathophysiology knowledge, and your pharmacology knowledge to this course. And if you don't do that, you're going to have a really hard time in the course. So make sure you have all those 3P books available to you when you're going to be working in the course. So it's up to you to be successful. We can't do it for you. We can guide you. We can give you all the tools, but we're not able to help you be or we're not able to be successful for you. And we look forward to a wonderful semester with all of you, and hope that you will really leave here learning a lot of information in regards to primary care one to take care of your patient.